Director, you can lead us.
Thank you and welcome. So in this caravan, this is where we are doing the vaccinations for COVID-19. Let me just ask the sister to tell us where number was. Sister, please just come and tell us how many we have done so far. We have done over 50 by lunch.
Yes.
Yeah. Please, just very briefly.
Yeah. So at the moment we are just here. We have done 65, but we also had a vaccination point somewhere where we've done 45. So total is 65 and 45. That is almost 110. Yes, 40.
Just today?
Yes, today only. Yes.
Which types do you have?
At the moment we have both Astra and Johnson.
And I'm sure everybody is going for Johnson. And what's going on there?
Yeah, thank you. Yeah. So as part of the vaccinations, this is where we are doing the data capture and data entry. The data system is such that once we enter, it's electronic. If you get to another facility within the country, they should be able to just enter your details and it will reflect that you got your vaccination already. Yeah. So this is where we're doing the data capture.
I don't understand why people are calling it 666. What is the resemblance of this?
It's just a myth.
Ignorance.
Yes.
Yes.
Yeah. It's actually a very good system because if I go to Chingola and I present my details, they enter in the system, it will pop up and it will show that I got vaccinated for Lusaka. Yeah.
I don't know why people are even worried about this card issue, card. You know, in German, I'm told you can't even jump a bus without a card. Yes. But them, they have them on their phones, all of them. Yes. You know, even them, I'm told, even going to a restaurant, you can't enter a restaurant unless you have this. That's what people are telling me. Exactly. That's how it is.
So this is where we're doing the data entry. And next, we can show you also another service. So in this caravan, we have been conducting voluntary male medical circumcision, which is an important strategy in the prevention of HIV and AIDS. Collectively, not just being circumcised, but following all the preventive measures, including male circumcision. By lunchtime, we have done 6. Emmanuel, how many have we done now?
I think we are
7.
Beyond 6 now.
How many? 7. Yeah, so that's quite good capture because it's within the environment. So if we are here for the 1 week, that means 70 plus. Yes. Sure. Yeah. So the response has been good. I'll ask Mr. Mwamba to also just explain about the advantages of the Shangring device.
Okay, this is
So
this is the new method that you have been discussing. We are now going to something that is non-surgical. So people would come within 5 minutes, they are circumcised, as compared to the one which would take 45 minutes.
Yes.
So men are now getting attracted. Those who are worried about the needles, there are no needles involved in this procedure. And so the pain is reduced and the bleeding is also reduced. And then also the bonus is that the cosmetic outcome of the procedure is very good as compared to the conventional one.
And you can go to work the same day, isn't it?
Yeah, you can immediately from the couch, you can move on and continue. So those of us who are still skeptical.
Okay. Especially the young students around here.
Yeah, so we need to make sure that we engage the colleges and universities. We need to make sure that we go and market this. It's not yet well known because it's a new thing. So we are still continuing with the messages. We are distributing brochures, making sure that. But the moment we get to the TV and the radios, I think it will be well known.
I think it's good that Madam Speaker is here. And Madam Speaker, I'm requesting that on Tuesday when we go back to the house and you talk about this place, you can mention this because your voice will be heard the whole country. So you can help us, by just mentioning that it's very important. You remember that this used to be done only in Northwestern. And circumcision has so many benefits for our young men, and even just men in general. especially in this era of diseases. It really helps. It's a clean way of staying. It's a way of staying clean. So at least if you mention it on radio when you are speaking, I think it will help us.
Yeah, we did that platform.
Actually.
Yeah, that platform. You see the witness
statement even on the World AIDS Day. Yes.
Even on the vaccination, you've seen Parliament is almost 90%
Yes,
done.
exactly.
The problem is that the Ministry of Health, we talk to ourselves as doctors. The information is not on the ground. So even this new system, people don't even know about it.
No, even me, I'm hearing it for the first time. Actually.
Even me, I heard about it for the first time when I became their minister. I was not going to know. So I know that the information, we are quite weak on information. So if you can help us, I think it will carry, you know. So just give her that small green pamphlet so she can go through it on her own time.
Promotion desk there.
Okay,
So for messages and you'll get to read through.
So you use it even on small boys?
Yeah, this ring is in sizes. Yeah, so in sizes, but currently because it's a new thing, we are very limited in terms of sizes. So 15 years and above. But it can be any size. But for early infant, we have other things that we are using, like the Makvan clamp. The 1 day old, we can also do circumcision, and she's one of the experts.
And also they have different people who does it. A man can choose whether he wants a woman nurse or a male nurse.
So this is a game changer. You can read at your comfort of your time and appreciate what you do.
Thank you so much. Thank you.
So on Tuesday, expect a statement.
Thank you.
That would be good.
So here we are doing the oral test and also screening for COVID. So it is also able to give us results in the shortest possible time. We are also testing for COVID and also testing for
How do you test for COVID?
you may just ask the officer. Please could you just come in?
Is this the nose one?
Yes, the nose of pharyngeal, yes.
And how many minutes does it take?
Only 10 to 15 minutes.
How many?
10 to 15 minutes.
To get the results?
Yes.
But what about to do?
To do is very much fast.
Okay. You can just test me. You will give me the result on the phone. That's a nice one. Just test.
Now you can not just test while giving the answer.
Sarah.
So this is the duty. We have our buffer here. We are ready. Just relax, breathe, and it will be done within the shortest possible time.
Okay.
She is strong.
So the results will come out when?
The next 10 to 15 minutes.
Okay, once we go to the next, you tell us.
Sister, tell us very quickly your signature here. Okay.
What's going on? What's this here? Okay, no. Just tell us what this is about.
This is we are vaccinating against cervical cancer. That is HPV vaccine to the women of childbearing age. That is from 14 to 15, and done on a 6-month interval. Once we give the vaccine today, then after 6 months again, child will receive the second.
So every 6 months?
Once we give the vaccine today, after 6 months again, the girl child has to give us the second.
And then after that again? Is that the end?
No.
Oh, is that the end? It's every year?
No.
That's the end.
Huh?
That's the end. Only twice.
Twice, that's what I'm saying, twice.
Yes.
Twice, that's all.
So 14 years, first you say January and the next one June. Then that's all. This is to prevent the young girls from getting cervical cancer as they grow. Now, Madam Speaker, you know that what I've come to learn is that many of our women are dying from cancerous diseases. They become very common. I was at the cancer disease hospital some 4 days ago. It's a very sad sight. And our system cannot absorb them. And because most of them come to the hospital when now it's in the 3rd or 4th stage, it's too late to save them. Same like breast cancer, and especially cervical cancer is very common. And I'm told that Zambia is number 3 in the whole of Africa, maybe even the whole world, in terms of numbers of women that are suffering from this disease. And so when they go late, it becomes too late, there's nothing, they are all just dying.
Yes.
Yeah, our cancer hospital has over 13,000 or 12,000, 13,000 patients coming into the cancer, but they're only able to look after 3,000. We don't have enough staff. I think there are only 7 specialists throughout the country. So 7 or specialists against 3,000. And then most of our machines are not working. They're very old, over 16 years. So it's better we do prevention, you know. So I'm happy that young girls are coming forward. So women must get vaccinated. I think it's safer for them. But the young girls, are they getting consent, or they're just deciding on their own?
They're getting consent.
Okay. Yeah.
So you're using the parents?
The parents, okay,
Yes,
very
the parents
good.
are giving consent.
Okay, yeah, because it's important. I hope parents, again, you can see that people don't, I didn't know about this vaccine until I became minister. So if I didn't know, I don't know how many people know. I think we're not doing very well.
We need
So in
more
education,
awareness.
Awareness. You see, all girls age 14 should get the vaccine against cervical cancer from their schools, health facility, or vaccination points. So we protect our young girls to secure the future. There are a lot of cervical cancer cases in Zambia, a lot, because of ignorance and because people don't know, but the vaccine is there. So and also checking, you know, those, I don't know how many, the women, when last you had your checkup? 2 years ago.
And probably because she's a medic.
Yes.
So the interval for the vaccine is 1 year now. The one we are giving now.
Not 6 months.
So it's 1 year. So this year,
then next year, then that's all.
Then you're done.
Okay. I wish we used to do like they used to do during our time. You know, they used to go to schools.
Yes, that time it was very active. It was called school health, eh?
Yes.
But now it's not so.
I think we need to get that again. The Ministry of Education, we can have a school, just like we have Child Health Week. We can have school health week. I think we must introduce that so that whole month we are just going around all the schools and the parents have been consulted. I think that's what we learn as we move around. Like now we've learned something from this that we must do that. So you've heard.
Yes,
Think around it and see which month is the best. It's January. We do it countrywide.
Thank you.
Thank you, ma'am. Thank you. Okay.
The girls are then still doing family planning. You're giving those tablets we used to eat, drink when we were young. And those injections here.
Yes. So this time around we have actually various methods. Yes, we have the short-term methods, like the oral contraceptives, those are tablets. Then we also have the injectables. So for the oral contraceptives, they check every day, and we give a cycle of 3 months to a woman. But for the injectables, we have 2 types. We have one that lasts 3 months after we inject. Then the other one will last for 2 months. Then we also have the long-term methods, like the implants. For the implants, we have 2 types. We have Implanon, which lasts for 3 years, and then the Jadeo, in effect, it lasts for 5 years.
Which is pocket.
The injectable one for 3 months is actually the most popular one. Yes, women, they forget taking the tablet. So they would rather get an injection and then come back after 3 months. You don't want to keep coming to the facility. Then we also have the IOCD, which is popularly known as the copper T one. Yeah, that one, the loop, it's popularly known as the loop. Yeah, that one lasts for 10 years. So we have all those methods and we have staff who are trained for all those methods. So we have them all in our facilities. This is the copper T one, which lasts for 10 years. This one, we put it right into the uterus. So it lasts for 10 years.
10 years, huh?
10 years.
But it's not popular.
This one, no.
Because people don't know in the mind that something is going in the body. Yes.
Yeah, so most women prefer the injectable one.
The injectable.
Injectable is quite popular. No, yeah. But even for the implants, the one that we insert under the skin, the popular one is the 3 years one.
Oh.
Yeah, because sometimes, men are difficult. They don't want to consent. So sometimes women just come privately to have them inserted. And then when they want a child, they'll come back running to have them removed. So the 5 years one is not as popular as the 3 years one because they know the children is so small. Yes. So we have all these things.
Now you should not be saying those things in front of men.
The women come back privately. Actually, this is what is going into the uterus, not the whole of this.
Oh, so
just
it's
this part.
yes. Yeah. And this is the part that prevents one from getting pregnant.
Yes, this is copper. And when it's inserted, it's releasing some copper solid for 10 years. After 10 years, the copper stops working. So you have to remove. And if a woman wants another one, you reset immediately.
Hey, our bodies.
We have IEC materials. This one is answering frequent asked questions about COVID. This one is talking about how the COVID vaccine is safe in people living with HIV. We've got the intermittent preventive treatment, which is fancied in pregnancy, trying to curb malaria in pregnant women. This is talking about menopause. The MMC, which is male voluntary circumcision. This one is talking about how to keep yourself after you've been circumcised with Shamrin. This one is talking about family planning, why we should invest in family planning. Then we're also doing distribution of male condoms and female condoms. So it's basically promoting health on this desk.
I think we need to do more in terms of going in the communities and giving this information to the people on the ground. I think that's where we need to work more harder. And the other way around is to ask that you go in the council. When they have a full council meeting, they give you an hour to speak to the leaders. Yes. So that you talk to them about circumcision, you talk to them about HIV, COVID, just in 1 hour. Then they can take that message in their communities. Then they can engage you now to go and give the actual service.
Honorable, just to add on what she has said, we have a number of volunteers from the community that we are working with. Some of us here are coming from the community.
Okay.
And we are now cooperating in the activities that we are doing so that it's easy if it's coming from somebody from where you're coming.
So do you go back and tell the people?
Yes, we do.
You do. For example, are you telling them about the new machine for circumcising? I don't think you tell them. I'm interested in that so that we stop transmission of HIV.
So the next
Thank you very much.
HIV testing.
How long is it taking you to test somebody to be able to tell them that they're positive or negative?
Less than 10 minutes.
Okay, that's good. But why don't you try and
That's another point. These two are volunteers. And we are raising young people in this fight instead of just health workers. We are hoping that going forward, when that CDF comes, this should be recommended to go and do nursing, because they have been working with us and we are grooming them.
Okay, yeah, sure, we can do that. Some of them, we can sponsor a few of
Go
them.
inside and sit.
We tested 25 today. We tested 25.
Table test.
Oh, that's good. Very good. But you are putting them on medication? Yeah. You must know that nobody dies of HIV now. It's like suffering from malaria. What is dangerous now is COVID, not HIV. And people don't be scared, and they should not stigmatize it.
And the last point is where we are doing cervical cancer screening and the testing. Could we come in?
Please.
Is there a client?
Come in.
Okay.
How many have you screened for today?
And there are some outside waiting, isn't it?
Okay, that's good. I had mine last week. Okay. Yeah, that's very good. You know, these free services. And the goodness with this is that if they find that you are immediately you are put on treatment and then you are okay. But if you are not quickly found, I met a number of women last 4 days when I was at the hospital, at the cancer hospital. I was I told myself, I said that we need to do more education so that we don't get here. Yes, awareness, and a lot of it, because especially these women coming from the provinces, because the whole cancer hospital, it has more people from home. I'm from Azapuro, I'm from Mansa, and they've come a long way, and it's not easy. And then they're told, the machines are not working, so they go back in pain. Come next month. Yes. So come next month. Next month when they come, they sit there the whole day, and then they're told, sorry, the machine is not working. If you want to go and pay 5,000 somewhere, because most of them can't afford it.
Give us a summary.
Okay, so for cervical cancer, we're actually doing two types of testing. So there's one where we use a camera, the VIA, like the one we had in the shop ground. Then there's this one that has been introduced now. It's a HPV DNA testing. Remember, we were passing through the vaccination that they shouldn't develop HPV. But now in adults, we do a self-testing. So we can actually go in the community and administer this pack. It's a complete pack.
Okay, so self-testing?
Self-testing, yes. So it comes, so for certain, there's a special brush that you use, but the one which is a brush, but this one is for provider. Okay. So you actually go, just get a sample, then you take to the lab, and you'll be able to test if there's HPV. Because remember, almost all the cervical cancer are caused by HPV. So if it's there now, then now we can bring the woman to. So with this now we can
go out in the field.
Yes, and we can be able to screen a lot of women.
And send them here when now you're ready for
only those who are positive.
Only those who are positive.
You do another.
Now that's when we can do now a physical.
So this is like a spot check. You check yourself, and then it gives an indication that there's something.
So this one is one of the recommended by WHO now. Even Ministry of Health now is recommending this one because it is highly sensitive. So when it says positive, it means really positive.
So out of the
when they test here, now we are able to tell which stage it is.
Oh, they can tell.
Yeah, you can because when it's positive, then you can even see the size of the lesion. If it's small, you can treat right here and there. If it's big, then you can do a surgery procedure called LIP. Then it's cancer. Then now we send to the cancer hospital.
Yeah, but this is what they told me, that the problem is people are going there when it's already too late.
Yes,
And they said there's nothing you can do here. You just try to slow the death, but otherwise it's too late. It starts spreading. And yet you can avoid it. Even for the breast, I wish you were teaching them also how to check the breast cancer.
So what we are doing, all the time that we are screening, we are even doing the breast. So we are incorporating the two.
You are incorporating. Excellent.
Actually, one of the breast check is done as they are doing this cervical cancer. It's part of it.
Okay.
Yes, total examination. So the breast is not left out.
Okay. I saw a lot of women whose breasts have been cut in the small hospitals where they are.
Yes.
I'm sure that some of our hospitals don't know what to do. So then they just rush to cut it off because they're thinking it will spread.
Right. Yes.
But if they come on time, they can save them even the breasts.
But Luna, I feel maybe in future, over time soon, more especially this exercise, if it to be brought to our members of parliament, like the way we're doing, whereby when we're doing the HIV, when we have function, the members of parliament are encouraged to come with their spouses so that they are tested, so that because the spouses of members of parliament, they are leaders in their constituencies, so they become part of the champions in this exercise. So I don't know, maybe in future as a ministry, maybe with that one we're going to discuss, because that's what we're doing with the HIV and AIDS. When we are training the members of parliament in the issues of HIV, we're allowing also their spouses to be part and parcel of that training. Because you, honorable member of parliament, when the parliament, all the time, women in the constituency, they are with the member of parliament's wife or the husband. So it's easy for her to take that message to those people, to become a champion or an advocate. I think it will help. So as you are planning, maybe next year, since this time planning is not there, maybe in the future, I think we should start planning on those lines, the way we're doing it with the HIV, because really, this cancer on women, it has to be spoken by women themselves. And if we want to reach out to the constituencies, let us use the members of parliament spouses, because you find that the wife to the member of parliament, in a day, I don't know how many people that he meets, especially women, they come to look for support from them. And she dies, who buys the coffin is a member of parliament. So the burden comes to this. So the advocates and awareness champions should go further even to the spouses.
So we can even take advantage and incorporate prostate cancer.
Yes, yes. We can do it at the same time.
So I will plan something, then we'll present to.
Can use Kappa. She's here. I think we'll
Kappa
protest
is the
it.
committee for all the MPs.
MP.
Oh, okay.
Fighting health problems.
Oh, okay. No, we'll take advantage of that.
The protested cancer is what I think.
Thank you very much, Madam Speaker, for
Thank
your
you so
interest.
much.
Yes.
No, we have interested issues of health. Very interesting. Oh, that's good. Yeah.
Now we have even gone further. Kappa, you are promoting One Health.
One health. Yes,
Yes.
you know, it's not
That's what
point
we are
talking
doing
about
now.
HIV alone.
No.
You leave the other disease.
No, we are doing One
Now
Health.
all the man is COVID, you
No.
forget even.
Yes, there are other issues.
No, we are doing now One
Take
Health.
them together. Oh,
Now we have even included animal diseases in One Health.
Okay.
Because we cannot be talking about human health, leaving out animal health. Because most of these diseases are coming from the food that we eat from the animals. So one animal health, the new strategic plan that they are planning this, it's included everything, including the environment. Imagine with a bad environment and then with you have got the COVID, cancer, what will happen to the person? Then we're in problems. So we are developing the strategic plan that is incorporating animal health, human health, and environment. And she has given us powerful team.
Oh, okay.
Just
Thank
have a
you so
question
much.
here on the live stream about sexually active, I mean, people who are not sexually active in terms of cervical cancer screening. Maybe it can be commented on.
So the question is,
Do they qualify?
Sexually active and cervical screening. Is
okay.
it only for those who are sexually active? Or?
okay, so I'll take it from where cervical cancer is coming from. Remember we mentioned to say it's the human papillomavirus, the HPV, that will cause about 99.9% of all cervical cancer as a result of HPV. And HPV is an STI, sexually transmitted. So for those that have never been exposed to sexual intercourse, we normally don't screen, because even the speculum will not go in.
Okay, so it's basically it's mainly those who are sexually active.
Not sexual active, because you can have just one intercourse, even if you're not sexual active. But if you got HPV, you can actually get.
Who has been involved in sex.
Yes.
There is also a standard from 25 and above, about 49 years. Yes, those you can test. And again, we find that there are those adolescents who are 18 years, below 20 years. But if she has a child, you can still go ahead and test. So the standard is 25 and going up to about 40.
But these days, the young girls of nowadays.
13 years.
Oh.
So if she has a child 13 years.
But is it about the issue? Anyone who is qualified to have an issue of a child?
Okay. Thank you. We are looking at those who are sexually active. 13 years they may be, but not.
They are, not they may be. They are.